Good afternoon. This is Mayor Bob Byrnes, Mayor of the City of Marshall. It is Friday at about 4:30 p.m. on April 17th. I'm here by distance, also with Dr. Steve Meister, who's connected by Zoom. Dr. Meister, of course, is a Marshall City Council member and Chief Medical Officer at Avera Marshall. We're here to give a update, share some information regarding the COVID-19 planning that has been going on in Marshall and in the Marshall region, as well as all over Minnesota. For the past number of weeks, the city, along with Avera, have really been engaged in some really good planning, and all of this planning is in preparation for what might happen, and that preparation all was in anticipation of a surge of people who would be infected with COVID-19 that would need hospitalization. So that planning was, how do we, from the city standpoint, how do we be sure that we have continuity of services that people depend on from the healthcare system? A lot of their planning was how can they have the capacity for the maximum amount that of individuals that may need their services, and that really has been good planning. Fortunately, a lot of the things that have happened in Minnesota, including the stay-at-home order by the governor, including the distancing that individuals have all been practicing, that has really allowed the time for some of this good planning. So we are, I think, as a community, in a pretty good situation. And Dr. Meister can really give more details on that. And then I'll come back and talk about a few other important things from the city perspective. Steve?
Thank you, Bob. As Mayor Byrnes said, we are preparing for the potential surge. And if you look at the numbers with this virus, the truth of the matter is it's a novel virus. So we really don't have expert ideas on anything. Everything that we've done, all the experts, epidemiological experts, medical experts, we're all working as we go because this is a novel, meaning new virus. We've not been exposed to it as human beings before. And so we make all the plans that we can make, and we take the data that has happened and extrapolate it and try to put it to what might happen or what will happen. But as we know, the history of these things is that we make plans and then there's a change in some of the data that we get. So we're doing what we think we need to do. And part of that, we know for certain that this virus is extremely pathogenic. And what does that mean? Pathogenic means that it is highly infectious. And people respond differently to the infection. There are a great many people who walk around completely asymptomatic with this infection. They're positive. They won't even know they're positive. However, we do know that a certain percentage, currently up to about 20% of people who get this sickness, will be really sick. Of those 20% who are really sick, 5%, and those numbers are consistent, are extraordinarily sick. And when I say extraordinarily sick, I mean they are on literally death's door. And these are where you see in New York City and New Jersey, Washington State, California. Internationally, you see the Italians and some of the other countries there that are being extremely affected. And so we are preparing for that number. Because if you take the numbers in Lyon County, there's 26,000 people in Lyon County. And we in Marshall, we're regional medical centers. So we not only serve Lyon County, we serve Lincoln County, Redwood County to some degree, Yellow Medicine County to some degree, Murray County to some degree, Redwood County to some degree. And we may even take other places because we're a rural area. And between here and Sioux Falls, Avera Marshall is the biggest hospital outside of Worthington. And to the north, we're the biggest hospital outside of Wilmer. And so we have to prepare for this large surge. And so we are preparing the Carlson Street Clinic for the potential that there might be more people. Now, there's been some rumors in the community, Bob, that we're getting ready for this. And because we're in a Avera hospital in Marshall, that we're getting ready to take residents from South Dakota. And some people are a little frightened about that because South Dakota and Minnesota have differed in their preparation. Well, I'm a doctor. And as a doctor, first off, I say I take care of patients, and I don't care where those patients come from because patients are patients. And, when we look at where they might come from, might they come from South Dakota? Well, they might, but that's because we probably sent them there for their heart attack or for um, something else that we needed to. Because right now, before COVID, if somebody came to Avera Marshall and we needed a subspecialist, a pulmonologist, a cardiologist, a neurosurgeon, an infectious disease expert, and we couldn't get what we needed over telehealth, we would actually send them to Avera, the McKinnon in Sioux Falls, South Dakota. That being said, with this COVID outbreak, we have a great integral transfer plan where we may take patients back and forth to allow the sickest of the sick to be where they can get the best care. And so the answer is yes, we might take patients who may reside in South Dakota, but it's probably unlikely. More likely, these people are from Minnesota and coming back from South Dakota. And so, the bottom line is we are making contingency plans for expansion of our hospital beds. We're doing that as part of being uh, good stewards of our resources and preparing for what we as a hospital and we as doctors do best, and that's taking care of sick people. And in this case, potentially a lot of sick people. Um, Everything we do before a pandemic is alarmist, and everything we do after a pandemic is inadequate. We're hoping that this is alarmist. We really are. I don't want to ever have to use anything outside of our regular hospital beds for sick patients because that tells me we've got way too many sick people. However, we need to prepare um, for the possibility that it may actually happen. So we're doing that. But patients are patients, and I explain to people, we live in southwestern Minnesota. We're closer to South Dakota than we are Minneapolis. And if you look at the Twin Cities greater metropolitan area, if you look at Forest Lake and Burnsville, those are two technically suburbs of the Twin Cities metropolitan area, and yet they're about as far apart from each other as we are from almost to Sioux Falls. So it's and certainly they are as far apart as we are from the South Dakota border if you head straight west. So that is where we're at. We are preparing for patient surge. The vast majority of those patients are probably going to be coming from the 5 or 6 county area in the local area. Are we going to card people and make sure that they have a Minnesota ID when they come to our hospital? No hospital has ever done that. No hospital ever will do that. And we certainly won't, because I have relatives in South Dakota. I have relatives in Iowa. I have relatives in Wisconsin. So that is where we're at.
Thank you, Steve. So a couple quick points. The planning, as Steve has said, is to handle the potential that might come from the Marshall trade area. That includes Marshall as well as the people in the surrounding counties that rely on Marshall for their health care, as well as employment and other things. The other areas, including Worthington, including the healthcare systems in Sioux Falls area, as well as other communities, regional communities in South Dakota, are doing similar planning. And again, the hope is that all of that planning will be more than adequate, will be over planned. This is also a good reminder that, there's in times like this, there's always the potential, great potential for embellished or misinformation. So Steve and I will do our best to share information as we know it, as transparent and often as possible. But if people do have questions, certainly contact the Avera number, contact the city of Marshall. As a city, I know we are all anxious for, to get past this, get our businesses back on track, people back to work that aren't working. But we also need to be prudent about how we do that and how we all stay safe. So thank you, Marshall, for continuing to do the right thing. This is Bob Byrnes, Mayor of the City of Marshall.
And this is Dr. Meister. Thank you very much.